Hello, my name is Christopher Lassiter Wagner. I will be discussing with you today the use of RN-led discharge education to improve patient preparedness and outcomes while reducing readmission rates in the NICU. Infants experiencing severe health issues in NICUs require complex medical care that persists even after they leave the hospital. The transition from hospital care to home settings presents families with an educational progression that is both extremely steep and difficult to navigate. The lack of adequate preparatory steps turn these transitions into agents that heighten parental anxiety while increasing caregiver errors and readmission rates. Healthcare systems evolving towards holistic patient and family-centered care models recognize RN-led discharge education as an effective intervention. This capstone explores how registered nurses can implement structured NICU discharge education to enhance caregiver readiness while simultaneously boosting health outcomes and reducing hospital readmission rates. The selection of this topic stems from the critical role nurses play in discharge education, combined with the myriad of challenges families face after NICU discharge. Many parents report feeling unready to handle their newborn's complex medical needs at home. The existing discharge processes show shortcomings as numerous NICU graduates return to hospitals for preventable issues such as feeding problems and respiratory distress. RN-led education programs provide caregivers with standardized content while offering personalized learning experiences. This slide demonstrates the gap between those who felt prepared and those who did not. With the use of RN-led education, this gap can not only be minimized, but also further enhance the level of readiness for those who feel prepared. Infant discharge procedures from NICU settings manifest as rushed operations marked by inconsistent practices and disjointed steps. The traditional discharge approach lacks the capacity to deliver ongoing support and personalized attention, causing numerous caregivers to face unpreparedness. Hospital readmission rates serve as a vital metric for discharge effectiveness according to the American Academy of Pediatrics. Studies demonstrate that nurse-led educational programs enhance parental confidence and reduce hospital readmissions. The implementation of RN-led teaching enhances clinical efficiency by mitigating home-based adverse events and reducing emergency visit occurrences. Through all of the research gathered, I formatted the following. What impact does RN-led discharge education, I, have on parental preparedness and 30-day post-discharge hospital readmission rates, O, for NICU infant parents, P, when compared to standard discharge education practices? C. B. Taylor and Hambridge K. 2025 saw research uncover that parents with infants in NICU settings faced widespread unpreparedness despite existing discharge programs. Smith et al. In 2022 promoted the incorporation of organized early discharge planning into family-centered care methodologies. The research by Balasandram et al. 2022 indicated that parents involved in nurse-led discharge education sessions reported enhanced satisfaction and readiness levels. The investigation by Sarik et al. 2022 explored telehealth extensions for RN-led education, which demonstrated effectiveness in mitigating post-discharge complications. Investigations conducted by Baroque and his team published in 2023 and Vance et al. Published in 2023 emphasized the critical need for integrated care management while promoting RN-led education programs as components of broad support networks. The works of Hanks 2021 together with K. Mink et al. 2022 verified that specialized discharge planning, when executed in a timely manner, improves patient results and system efficiency. By using conventional methods of discharge planning education and providing a family-centered approach, the entire medical team can provide support to parents while providing them with hands-on education. This approach can minimize dissatisfaction and improve patient outcomes while working to lower readmission rates. The collection of involved parties include NICU nurses together with neonatologists and social workers, plus hospital administrators and families. Registered nurse programs require extensive institutional financial support to develop nurse education and interprofessional collaboration. The creation of formal educational and advocacy positions delivers substantial benefits to nursing practitioners. Families receive personalized, direct instruction that equips them to manage complex home health care requirements. Hospital administrators gain benefits from decreased readmission rates while simultaneously achieving higher patient satisfaction scores. The simultaneous occurrence of limited nursing staff availability, together with caregiver health literacy disparities and telehealth technology access inequalities, establishes potential obstacles. Addressing these challenges demands intricate institutional policy changes alongside targeted communication methods and resource allocation for nurse educators. Registered nurses begin discharge planning at the start of the NICU stay, which then progresses in response to the infant's changing condition. Educational dissemination occurred through bedside instruction combined with digital models and printed guides, enhanced by simulation techniques. Nurses conducted caregiver skill assessments before patient discharge while providing follow-up support through telehealth services. The program sought to maintain consistent care and delivery by integrating standardized checklists with interdisciplinary collaboration to ensure medical service continuity. Programs designed to train nurses in sophisticated teaching methods and cultural awareness skills would be put into practice. Parents would gain proficiency in infant CPR together with medication administration and feeding techniques while simultaneously learning to identify signs of health decline. The program would experience refinement through the integration of stakeholders into feedback loops while standard staff meetings serve as briefings. The integration of translation services with prolonged educational timelines and psychosocial support presents potential methods to address language barriers while reducing caregiver stress. By adding the use of telehealth for parents with an infant who has been discharged from the NICU, we can provide one-on-one live support to parents with the goal of reducing readmission rates. The expected outcomes include increased caregiver knowledge and decreased anxiety, which combined with heightened confidence led to reduced 30-day hospital readmission rates. The evaluation process combines initial and final educational assessments with caregiver readiness surveys and readmission data tracking through electronic health records. Data collection processes demand the combined use of anonymous caregiver feedback with NICU follow-up records and nurse educator documentation. The evaluation of success would rely on statistical examination of readmission rates before and after implementation. The assessment of project results takes place through presentations at neonatal nursing conferences, hospital quality improvement meetings, and publication in peer-reviewed journals. Local medical institutions, together with nursing educational facilities, possess the ability to employ research data to organize specialized workshops. To acquire continuing education hours, healthcare professionals must engage in a cooperative initiative with hospital education departments and organizations such as the National Association of Neonatal Nurses. An application would be submitted with learning objectives, content outline, and assessment tools. The foundational elements established in the report by Kaming et al. 2022 create a platform to convey the capstone project's significance to clinical professionals. Early structured education programs with registered nurses as key facilitators make NICU discharge processes more timely and efficient. This information showcases how nurse-led discharge planning strengthens family support systems and enhances post-discharge outcomes while healthcare teams, hospital administrators, and professional nursing organizations can use these findings to advocate for broader implementation of RN-led discharge education models. The transition period when infants leave NICU for home care constitutes a delicate phase that demands meticulously crafted support programs. The implementation of RN-led discharge education programs creates an effective system that equips parents for newborn care while reducing hospital readmissions and improving infant health metrics. Through nurse-led programs, hospitals achieve greater equity and effectiveness in neonatal care delivery while also enhancing operational efficiency. The proposed capstone project stands on extensive research intertwined with practical application to deliver a sustainable model for NICU transition improvements. This chart emphasizes the value of RN-led education in preparing parents with an infant in the NICU for discharge. You can see the more than 50% increase in confidence before and after the education was provided. Below is page 1 of references. Below is the last page of references.